So today, we're going to jump right into the world of urosurgery and really try to understand some critical penile disorders. We're going to look at this from a surgeon's point of view, which is all about one thing: separating the minor stuff from the true medical emergencies where every single second counts.
Okay, so let's start with a real-world scenario. And look, this isn't just some textbook example. This is exactly the kind of case that can walk into an emergency room at any time. You've got a young guy, 6 hours into a painful, persistent erection. Right away, you know the clock is ticking.
And that really gets to the heart of it, right? In a situation like this, a surgeon has to make a call, and they have to make it fast. So when exactly does something like this cross that line from just being a problem into a full-blown function-threatening emergency? Well, let's find out.
To really get what goes wrong, first we have to understand how it's all supposed to work in the first place. And honestly, it's not as complex as you might think. It really all boils down to a surprisingly simple hydraulic system.
This diagram here shows it perfectly. Look at the top image, the flaccid state. Blood can flow in, blood can flow out, no big deal. But for an erection, that's the bottom diagram. The arteries open way up, flooding these chambers, the corpus cavernosa, with blood. And all that pressure does something clever. It physically squeezes the veins shut, trapping the blood inside. It's basically a brilliant, simple one-way valve. So, what happens when that elegant little system breaks down? Specifically, what if that out valve, the veins, fail to open back up and the blood just stays trapped? Well, that brings us to our first major disorder, priapism. Now, the actual medical definition is super specific. Priapism isn't just any old erection. It's prolonged, it's unwanted, it's totally disconnected from any kind of sexual desire, and, here's the key part, it lasts more than 4 hours. That 4-hour mark, that's the first really critical number you need to remember.
And this is absolutely vital to understand. Not all priapism is the same. On the left, you have high flow. It's caused by an arterial issue, it's usually painless, and, importantly, it is not an emergency. But the one on the right, low flow, or ischemic priapism, that's a whole different story. That's a venous problem, blood is trapped and it can't get out. It's incredibly painful, and it is a true capital E emergency. Why? Because that trapped blood has no oxygen and the tissue starts to die. Fast.
So, for that ischemic priapism, a surgeon has a clear playbook. The first move is usually conservative. Try to drain the old, stagnant blood, and maybe inject some drugs to get the blood flow back to normal. If that doesn't work and you're still within about 48 hours, they can surgically create a shunt. Think of it as a new escape route for the blood. But look at the far right of this flowchart. If you wait past 72 hours, the tissue damage can be so bad that the only option left might be to implant a penile prosthesis. It just goes to show time is absolutely everything.
Okay, so we've talked about priapism, but this idea of a urological emergency also applies to a couple of other key conditions. Let's touch on physical trauma and some specific issues with the foreskill.
Now, a penile fracture, and I'm using air quotes here, isn't what you probably think. There's no bone to break. What it actually is a tear in the tough, fibrous sheath that surrounds those erection chambers. It's a serious injury, usually happens during intercourse, and the diagnosis is simple. It's a surgical emergency, period. It needs to be repaired urgently to prevent permanent problems.
All right, these two terms sound almost identical, but believe me, they are worlds apart in terms of urgency. Phimosis is when you can't pull the foreskin back. It can be an issue, for sure, but it's not usually an emergency. Paraphimosis, on the other hand, is when the foreskin is pulled back, but then it gets stuck there. It acts like a tight band, a tourniquet, cutting off blood flow and causing a ton of swelling. And that makes paraphimosis another true urological emergency.
Phew, okay, we've covered a lot of ground here, the mechanics, the key conditions, so let's boil it all down from that surgeon's perspective. What are the absolute, no kidding, red flags? The signs that mean you need to get medical help, like right now.
Let's make this crystal clear. These are the takeaways. You need to seek urgent help if you have an unwanted, painful erection that goes on for more than 4 hours. That's our ischemic priapism. If there's sudden, severe pain during intercourse, maybe even with an audible popping sound, that could be a penile fracture. And finally, if a retracted foreskin gets stuck and starts to swell up, that's paraphimosis. Those three are non-negotiable emergencies.
And this all brings us to a much bigger thought. Understanding these conditions isn't just for surgeons. Knowing the difference between something that can wait and something that's a true, time-sensitive emergency, that's information that can prevent lifelong damage. Which kind of leaves us with this question to chew on. Are we really taught enough about when and how to get urgent help for our own bodies? It's definitely something to think about.